name's Tracy Locke. I am a nurse that specializes in wound ostomy incontinence, and a part of that role is ensuring that our patients and clients have good skin health, and we're doing the best we can in preventing pressure injuries while patients are bedbound or have a difficulty with moving. So we're going to start right away looking at some of the things that can interfere with skin health and can actually promote increased breakdown of skin, one of it being caused by heat, moisture, and the other one by pressure. So everybody has high risks of pressure based on their coccyx, heels, just areas that tend to be a little bit bonier. And then again, when you're coming into hospital, sometimes we have issues with moisture balance. So it could be related to sweating, it could be related to incontinence issues. And so what we want to do is ensure that we're creating the least amount of layers that will promote skin protection and offload areas. So that could be offloading, could be Roho cushions, the type of mattresses we use, even mobility of the client in the bed or the patient in the bed. So offloading them off their hips, offloading heels so they're not digging. And the other thing is how we have the head of the bed up. So we want to be looking at things like decreasing friction and shearing, especially putting them up in the bed or the head of the bed up. So right now we have kind of a standard made bed with a slider sheet, which is the most important if you have someone who has decreased mobility and cannot move themselves up in the bed. And then what we have is what is called Steiner pads. We used to call them pink pads. And these were developed many years ago as a means to help with absorbing, and I put that in quotations, of incontinence or moisture. And if anyone has ever been on them or changed them, they actually don't wick moisture away from the skin. So once they become wet, they're wet, and that is sitting against your patient's skin. So let's have a look at what it looks like when the head of the bed goes up, and how does that feel to the patient in the bed. And you can see the bunching in the coccyx. And if your patient were to be moving around in the bed, how does that feel for you? Right, your bum's kind of sucked right in. But if you were sitting there for a long length of time, let's say a couple of hours in that position, how do you think you'd start feeling? Now put an incontinent brief on you.
A lot of pressure here.
In your shoulders.
Pressure here, and yeah, it just I feel like a pretzel.
Yeah. So what I'd like to do is kind of remove those layers and see what it feels like with less on there. And again, using things if you need them, not just doing them automatic. Not everybody needs an incontinent brief. We should be doing toileting schedules, right? We should be doing things that are promoting skin health. So pH neutral soaps, pH neutral lotions. So we have different levels of creams and moisturizer that would help moisturize skin and also create a protective barrier. So they have a silicone, dimethicone, so that helps decrease that friction. So ideally what we'd like to see is people less sitting upright in bed and either sitting upright in a chair or on the bedside if they have upper mobility, like kind of moving around and getting around more. So I'd like to take this out, and then what I'd like to see is if they have moisture balance issues, whether it's related to incontinence, sweating, is the use of the Ultrasorbs if they need it. So again, not every bed should be made up with it. We want to promote people to get to their best function. So if they weren't incontinent coming in, we don't want to create incontinence, or sometimes there's little setbacks. So if someone has a catheter because they've got issues going on and we've had to catheterize them, obviously we want to do it as short amount as possible to prevent infections, but Do they also need an incontinent brief? So again, talking to your patients, asking them, did they have issues at home? What were the cause of the issues? So we want to promote them to get to their best functions because we're trying to get them home. So an UltraSorb actually has wicking bead technology. So this will hold almost up to 1,000, like a liter or 1,000 mils of fluid. And that will actually pull moisture away. Obviously, there's a certain capacity to them. And again, these will bunch up, but they're a lot more breathable underneath somebody than one of these old Steiners. Doing regular skin checks, so on admission, your Braden risk assessment, and then it should be done according to their risk scale number, and then following through with those interventions based on that. So do they need pressure reduction mattresses? Get your rehab team involved. Do they have poor nutritional intake? Get your dietitian involved. So you've got lots of resources at your hand. Do they already have skin breakdown? Get your NSWAP that's involved. So there's many things kind of at the fingertips that we can do in that short amount of time that they may be staying in a hospital. So as of February 20th, we're going to be doing a little pilot project to see if removing these layers and all the strategies that we're going to be putting into place for skin health and pressure injury prevention is going to work. We worked with housekeeping, and we're going to be removing the Steiner pads. And if a client or patient needs something for moisture, we're going to be adding the UltraSorbs instead in place of. So the standard bed now will be made with the bottom sheet and your slider, and then that's it. So it'll be beds will be made based on individual assessments of your patients. So what we've done to help prompt everybody, because pressure injury prevention is a team approach. So it's not just the care aide, the nursing staff, it's family, it's the patients themselves, it's the other allied staff members that come in. So we're gonna post these at the head of the bed, in every bed, I believe, throughout the whole hospital. And this is just a cue of some of these areas, majority of the areas that are more at risk for pressure injury. So when we're checking patients and we're helping them with their wash or any of those kind of ADLs that you're doing on each shift, is assessing those areas. So it's a quick visual. It has all the anatomical descriptors that will be made available as part of our skin health pressure injury prevention program we're rolling out, and there'll be more information as it comes. So stay tuned, and thank you for your time.